Okay, so today we're gonna talk about Tourette syndrome. Tourette syndrome is a disorder that involves repetitive movements or sound that can't be easily controlled. For example, you might repeatedly blink your eyes, shrug your shoulders, or blurt out unusual sounds or offensive words. Uh, Tics or unwanted sounds are usually show up between the age of 2 to 15, with an average of 6 years old. Tourette syndrome is 3 to 4 times profound in males more than females. There is no cure for Tourette syndrome, but there are treatments. Many people with Tourette syndrome don't need treatment when symptoms aren't troublesome. Unwanted sounds and tics can be controlled after the teen years. Unwanted movements or sound are the hallmark sign in Tourette syndrome. They can range from mild to severe. Severe symptoms can interfere with communication, daily functioning, and quality of life. There are two types of tics or unwanted movements or sounds. Simple tics, which involves a limited number of muscle groups, and complex tics, which involves several muscle groups. Tics can also involve movements, which is abbreviated as motor tics or sounds vocal tics. Motor tics usually happen before vocal tics, but the spectrum of tics that people experience is diverse. Common motor tics seen in Tourette syndrome include, in simple tics, there is eye blinking, head jerking, shoulder shrugging, eye darting, which is casting your eyes suddenly and rapidly in a particular direction, nose twitching, and mouth movements. In complex tics, there is touching or smelling objects, repeating observed movements, tipping in a certain pattern, obscene gesturing, bending or twisting, hopping. Common vocal tics in Tourette syndrome. In simple tics, there is grunting, coughing, throat clearing, barking. In complex tics, there is repeating one's own words or phrases, repeating others' words or phrases, using vulgar, obscene, or swear words. Now,
Before we play the video, go to the past slide. Okay, so one of the things that caught my eyes is using vulgar or like swear words for no reason. I just like I can't help but ask myself, why does that happen?
I think I have like something to comment about this, since
Go ahead.
you mentioned it. So, because Tourette is basically uncontrollable movements, including your throat, which is why he said barking, something similar to barking. And since your brain knows how to say phrases, it can uncontrollably say phrases. You have the uncontrollable urge to say something, and sometimes it's a vulgar word, I guess, because it's part of your dictionary inside your brain, and you involuntarily say it, involuntarily say it because it's there, and you know it, so you say it.
What I'm trying to say is that out of all the words in your dictionary, as you
barking is also not expected, and saying any phrase you can also say that to any phrase. It's just you have a dictionary inside your brain, and whatever comes out, whether it's a swear word or a phrase or anything.
It's like I don't know, but it's definitely something to look into.
Maybe swear words came out because it's what you would usually say when you used to.
Yeah, probably. Maybe because you use that frequently.
Maybe. Depends on the person, though.
Yeah.
So, I mean, we could look more into that.
This is why they're on the complex tics and not simple tics.
That makes sense, yeah.
Because it's complex movement. You're making a word, not just a simple sound.
Yep. Really bad disease.
tics can
It's a
vary.
disorder, not a disease. But okay.
Yeah, it's a syndrome.
Or that.
Tics.
All right,
Tics
excuse me for that.
So tics can vary in type, frequency, and severity. Worsen if you're ill, stressed, anxious, tired, or excited. Occur during sleep. Change over time. Worsen in early teenage years and improve during the transition to adulthood. Before you experience vocal or motor tics, you'll likely to experience uncomfortable bodily sensations such as an itch, a tingle, or tension. See your pediatrician if you notice displaying involuntary movements or sounds. Not all tics indicate Tourette syndrome. Some tics may go away after a few weeks or months, but whenever a child shows unusual behavior, it's important to identify the cause and rule out serious health problems. The exact cause of Tourette syndrome isn't known. It's a complex disorder likely caused by a combination of inherited and environmental factors. Chemicals in the brain that transmit nerve impulses, which are neurotransmitters, including dopamine and serotonin, might play a role. Risk factors may include family history. Having a family history of Tourette's syndrome or other tic disorder might increase the risk of developing it yourself. And gender, males are about 3 to 4 times vulnerable than females to develop Tourette syndrome. People with Tourette syndrome often lead healthy, active lives, but it frequently involves behavioral and social challenges that can harm your self-image. Conditions often associated with Tourette syndrome include ADHD, obsessive-compulsive disorder, autism spectrum disorder, which we will talk about tomorrow, learning disabilities, sleep disorders, depression, anxiety disorders, pain related to tics, especially headaches, anger management problems.
Okay, so diagnosis. Um, so as like other mental diseases, there's no specific test that can diagnose Tourette syndrome. The diagnosis is based on the history of your signs and symptoms. So you tell the doctor, not you, and or any person tells the doctor his symptoms. This is the main way. Symptoms, how long they've been there, and like details on the symptoms, and he'll label it as Tourette syndrome or not. Both motor tics and vocal tics are present, although not necessarily at the same time. Tics occur several times a day, nearly every day, or intermittently for more than a year. Tics begin before the age of 18. Tics aren't caused by medication or other substances. So they want to make sure that these tics are natural, not because a specific thing that they intake or any substances that they take that cause these tics. Tics must change over time in location, frequency, type, complexity, or severity. It's not always the same thing. So basically, these are just condition like to decide whether the condition is Tourette syndrome or not. Just the criteria that falls under that you need to fall under in order for you to be diagnosed with Tourette syndrome. Next slide. Diagnosis. A diagnosis of Tourette syndrome might be overlooked because the signs can mimic other conditions. Eye blinking might be okay. So they're saying is not all symptoms, like the symptoms of Tourette syndrome can be a symptom of another case. Like if a guy is eye blinking and no other symptoms of Tourette syndrome are there, maybe he has a vision problem rather than a mental problem. So or sniffling. Sniffling is a symptom of Tourette syndrome, but it's also it also happens if there's an allergy involved. So that's a thing that a doctor could look out for while diagnosing Tourette syndrome. Both motor and vocal tics can be caused by conditions other than Tourette syndrome. To rule out other causes of tics, okay, so some like there are tics, but you're not sure if they're caused by Tourette syndrome or not. Your doctor might do these two following things. Imaging studies such as an MRI, take an MRI of your brain and see what happens, or a blood test. A blood test is I tried to research what exactly that they look for in a blood test. I know it's probably something that released after the tic, but I'm not sure. Mr. Natpon, do you know any? Why would what they look for in a blood test? Or does anybody know what they look for in a blood test?
I have no idea.
Yeah, I tried looking for it, but I couldn't see exactly what they look for.
Yeah.
But it's probably something released after the tick evolved. There's no cure for Tourette syndrome. Treatment is aimed at controlling tics that interfere with everyday activities and functioning. Well, when tics are severe, treatment might not be necessary. Okay, so it depends on the severity. If treatment is so, if it's severe, treatment aims to control it because there's no exact cure for this for this syndrome or condition. They try to control it and cope with it as much as possible. And if it's not severe, most likely nothing will happen.
My guess, now that I've thought for about 30 seconds, is hematocrit and then hemoglobin to process oxygen flow throughout your brain. Because if that's not good, then you're not going to be able to control your actions and your comorbid symptoms would increase. But that's a pure guess. But I thought I'd say something since you put me on the spot. That's my guess.
Oh, I'm sorry for putting you on the spot then.
I like it. It's fine.
All right. Thank you, Mr. Natapon. Medications to help control tics or reduce symptoms related to condition. So they use specific medications to control this. Medication include medications that block or lessen dopamine. Usually, when this condition happens, there's an overdose of not overdose. That's not the word I would say. When there's unwanted dopamine release, they try to block or lessen it, so these unwanted responses don't happen. There's all types of different medications for that specific thing. Other thing that they may do is injections to help control the muscle, so they don't go to the mental straight away. They control the twitching by controlling the muscle related to the tic, local or simple. ADHD medication, since ADHD is technically related to Tourette syndrome, and the fact that they both include an activity that's unwanted or more hyperactivity, they might use the same medication for ADHD and Tourette syndrome.
I heard that when a person with Tourette's is like really focused in something they're saying or something they're doing, they stop the tic. Is that true, or is it just?
Yeah, I think it has to do with the muscle injections. They inject something in the muscle for this specific part that's twitching, and they help control it by that way.
No, I meant not. I mean when they're focusing, like imagine me explaining a lesson to you, and because I'm so involved with the lesson, and I lose like focus of the twitching, and I don't twitch a lot, and I just explain and talk. Is that true? Like they focus so much that they on something that they forget to tick or something.
Oh, okay. I think I see. I see what you're saying. Tics increase as you have more stress or anxiety. So if you're not stressed and you're happy, tics dramatically decrease.
I see. Makes sense.
Does that answer your question?
Yeah, it answers my question.
All right. Good question. I like that one. Next slide.
That's true with.
Go ahead.
Sorry. That's true with autism too. There's a spectrum of autism, but some severe autistic cases necessitate constant brushing on the back of the child's hand so that they stay calm. So anything that will help maintain calmness is going to help with this. That's like a common theme with these syndromes or disorders, because I think it's very fascinating how he displayed the classic symptoms, but then you got to see how Tourette's is associated with how offensive they want to be to, but it's not controlled. It's impulsive. They have no control over it. But he's taking the hijab off. He's maybe calling black people bad names in public. So that's not going to be
I
good.
saw a streamer, Mister, that said that has Tourette's, and they blurted out N-word.
Yeah. And so that's a lack of control, because you have this crazy child running around in a 5th grade class, normal, not Tourette's, lack of control because of their age, they're young. That has something to do with this lack of control. But in Tourette's, it's connected between the emotions in the amygdala, which is above the brainstem, and then the basal ganglia, which connects all of your motor functions. So then you have these shoulder twitches and then mouth twitches and whistling and everything else. But I think it's connected somehow. I'm sure if you look really closely in between all of the neuronal tissue and stuff, you'll find some interconnectivity between why there's a lack of control for behavior and what you say to be polite and politically correct and all that stuff, and then body control, because control is control. It's just dispersed separately through various nerves. And that's interesting to me. Like, that's really interesting. Okay.
Okay, other types of medication. Central adrenergic inhibitors, medications such as clonidine and whatever this is, typically prescribed for high blood pressure. So another symptom I would say is high blood pressure, and it might help control the behavioral symptoms, such as impulse control problems and rage attacks. Side effects may include sleepiness. Antidepressants. I think this is for to control the symptoms of the side conditions that come with this, such as sadness and anxiety and OCDs. It's not necessarily to do with the Tourette syndrome. It usually has to do with the side effects. Anti-seizure medications. Recent studies suggest that some people with Tourette syndrome respond to topiramate, which is used to treat epilepsy. It's another medication that they found useful in this condition. Next slide. Okay, so behavioral therapy. There's a different ways to approach this. One thing is cognitive behavioral intervention for tics include habit reversing training. Can help you monitor tics, identify premonitory urges, and learn to voluntarily move in a way that's incompatible with the tic. So basically, they make you build habits and make like learning more about yourself and your tics in a way that you build habits and things to cope with these tics, and they won't be as bad as if you didn't. Like, for example, you do a way that you can feel the tic coming, and you get out of the way, or any type of thing that helps you cope with this situation. Psychotherapy. This is to doing with the accompanying problem of Tourette syndrome, such as ADHD, depression, and anxiety. We talked about psychotherapy before, during social anxiety, depression, and all those types of things. With Tourette syndrome comes side problems, since a lot of the neurotransmitters that are involved with this specific condition, such as dopamine, such as serotonin, are the same for other conditions. So if there's a problem here and this is causing these symptoms, it's probably going to cause other symptoms because it's the same neurotransmitter at the end of the day. So they do psychotherapy to deal with the other conditions. Deep brain stimulation. This was the one that I was talking about when we watched the first video. I think we should play it at the end of the presentation, but it's when they do a surgery and they attach they put electric impulses to control the symptoms of Tourette syndrome. Next slide. Coping and supporting. Your self-esteem may suffer as a result of Tourette syndrome. You may be embarrassed about your tics and hesitate to engage in social activities. As a result, you are at increased risk of depression and substance abuse. So let's say you are talking with someone and suddenly, let's make it worse. You're talking to an important figure, let's say the principal of the school. And while you were talking to him, you just twitch and do a social movement. Or in the worst case scenarios, you say a curse word by accident. You're gonna be embarrassed by that moment, and as a result of that, you may end up getting depression or being anxious about that, and for after that, you get traumatized, and maybe it becomes a phobia of talking to important figures. So there's a lot of things that can develop with these tics. To cope with Tourette syndrome, remember that tics usually reach their peak in the early teens and improve as you get older. So usually these tics are in the teen years, and then after you grow up, they slowly go away. Reach out to others dealing with Tourette syndrome for information, coping tips, and support. Basically, if a person has Tourette syndrome, they need to find every possible way to cope and support against this, to cope with the conditions. Next slide. Children with Tourette syndrome. School may pose special challenges for kids with Tourette syndrome. We know kids, they don't really understand what's going on, especially if a person has a mental disease. So they can bully him, they can make fun of him. So it could be a really hard time for the child. Be your child's advocate. Help educate teachers and school bus drivers. Basically, the parents of the student needs to tell everybody at the school that he has this disease, and he needs to give them tips on how to deal with the child, because his tics are uncontrollable, and they need to cope with him. It's a group effort at the end of the day. Nurture your child's self-esteem. Don't let him be depressed. Tell him what's going on. Like if he does this movement and he gets bullied, he might, in the worst case scenario, commit suicide. So it's hard to make sure that he's in a positive mood. Find a support group. To help cope, seek out local Tourette syndrome support groups. Pretty self-explanatory.
Attention.